Hello, I am Nadine Carty-Keynes, and thank you for joining us at the Nevis Emergency Operations Center, EOC, today, Monday, 7th September 2020, for an update on the situation regarding the novel coronavirus, COVID-19, on Nevis. Again, I would like to take this opportunity to welcome all of our viewers, and I also want to thank our media houses for joining us every week as we provide these briefings. Just to remind persons that questions will be taken at the end after all the presenters would have presented. The Nevis COVID-19 briefings are aired on Mondays at 8:30 p.m. on Nevis Television, or you can view these briefings on YouTube and Facebook pages of Nevis Television, Nevis HPU, and the Instagram page, Nevis NDMD, and Vaughan Radio every Tuesday at 1 p.m. With us this evening, we have Mr. Brian Dyer, Director of the Nevis Emergency Operations Center, Mr. Lyndon David, Superintendent of the Nevis Division of the Royal St. Kitts and Nevis Police Force, Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force. We have with us Dr. Duana Pemberton, General Practitioner at the Accident and Emergency Area at the Alexandra Hospital, Nurse Chandrika Prasad Wallace, Assistant Nurse Manager in A&E, and also Assistant in Infection Prevention and Control. And finally, we have Ms. Zanella Claxton, Principal Education Officer in the Department of Education, Ministry of Education. I'd now like to welcome Mr. Brian Dyer, who will provide his updates for us here at the EOC.
Good evening all. We start again with some activities in the tropics. We now have, as of 11 a.m. this morning, we had Tropical Depression 17 upgrading to Tropical Storm Paulette. As 11 a.m., Depression 17 became Tropical Storm Paulette over the Central Tropical Atlantic. Summary location 17.2 north, 42.2 west, about 1,205 miles west of the Cape Verde Islands, or 1,375 miles east of the Northern Leeward Islands. Maximum sustained winds 40 miles per hour, and present movement west-northwest at 3 miles per hour. Minimum central pressure at 1005 millibars. This is telling us, based on the west-northwest tracking, that this system would pass to the northeast of the Leeward Islands on its present track. So this one would pass us to the north and would provide us probably with some rough seas by Thursday and Friday of this week. Currently, there are no coastal watches or warning in effect. And we now look at the other systems in the Atlantic. An area of low pressure located just south of Bermuda is producing disorganized showers and a few thunderstorms. Some slow development of this system is possible or during the next couple of days. Formation chance for 48 hours low at 10%, and formation chance for 5 days low at 30%. This system would affect the U.S. mainland based on its projected track. What is of interest to us in the Leeward Islands, a tropical wave is forecast to emerge off the west coast of Africa late Wednesday or Thursday this week. Gradual development is anticipated once the system is over open waters. A tropical depression could form later this week or over the weekend, while the system moves gradually westwards across the eastern Atlantic. Formation chance through 48 hours low, 0%. Formation chance for 5 days, medium at 50%. This system is currently tracking westerly, which will bring it closer to the Leeward Islands. So we have to pay attention to the system as it would be approaching the island chain by Wednesday of next week. Moving on, we are in the peak of the Atlantic hurricane season, and I have provided you a graphic to show which months are in the peak of the hurricane season. This is the 7th of September, and based on the statistics, the 10th of September is the actual peak of the entire Atlantic hurricane season, where most hurricanes tend to occur on the 10th of September or just after that date. So again, this week signifies the peak of the Atlantic hurricane season. Right? We are at this point up to 18 named storms. So we continue to monitor the Atlantic for any other activity that may come our way. Moving on, there are some persons who have contacted the department with regards to hurricane tracking. So I have provided a graphic of what a rudimentary hurricane tracking chart would look like. And persons who are interested in downloading this chart, you can download this chart from the National Hurricane Center page or from the disaster management page, ndmd.kn, under the hurricane tab or hurricane hazard tab. You can find this graphic, so you can download in PDF format, so you can do your own tracking at home. Again, continue to be vigilant and monitor the radio stations. The Met Office will provide updates with regards to the weather systems approaching us, and be prepared. In a moment's notice, we may have to issue watches and warning as the tropical weather systems develop and approach the island chain. Thank you very much.
Thank you so much, Mr. Dyer, for your updates. I'd now like to welcome Dr. Judy Nisbet, Chair of the Nevis COVID-19 Task Force, to provide her updates.
Thank you, Madam Chair, and good evening to everyone. I will start with the global situation, as I usually do. As of today, 7th September, there have been 27,032,617 confirmed cases of COVID-19, including 881,464 deaths reported by the World Health Organization. This is 2 million more confirmed cases than a week ago, when WHO reported just over 25 million confirmed cases, and 37,000 more deaths than reported 1 week ago. In our region of the world, the Americas, there are over 14 million confirmed cases, 1 million more than last week, with the USA and Brazil continuing to see increase in cases. According to the Caribbean Public Health Agency, CARPHA, as of 4 days ago, on September 3rd, there were 172,601 confirmed cases, 97,120 recovered cases, and 2,915 deaths. On Nevis, we continue to test. However, these are not suspected cases that we are testing, but persons who are traveling to other countries and persons leaving quarantine. We have tested so far, since March, 331 persons, with 327 persons testing negative, and currently we have no pending results. So since we commenced testing in March, we have had 4 positive cases, and as of today, we have released 349 persons from quarantine. In terms of repatriation, over the past 130 days, 159 persons have entered Nevis and placed in quarantine. 126 have completed quarantine, they have tested negative, and they have left quarantine. Therefore, currently, there are 33 persons at our quarantine sites in mandatory quarantine. Now, just some information regarding home quarantine, we have heard that home quarantine is now allowed in some situations. Quarantine in homes, hotels, villas, apartments, etc., is now allowed for persons who are interested in doing so. However, there are certain criteria that must be met for this to happen. First, an application must be sent to the COVID-19 task force. There's an application fee that is attached of EC $250. An appointment will have to be made to visit the property. So the COVID-19 task force will have to visit the property to ensure that the property is suitable for quarantine. Once all the criteria are met, then an application is made to the Commissioner of Police so that a pre-approved private security firm can be assigned and a contractual agreement will be entered into between the security firm and the applicant. And all costs for security and any other costs while in quarantine will be met by the applicant. Further information can be sought regarding this by calling the disaster management offices at 469-1423 or by sending an email to the COVID-19 task force at COVID-19 taskforce@niagov.com. Thank you.
Thank you, Dr. Nesbitt, for your updates. I'd now like to welcome Superintendent David as he provides his updates.
Good evening all. Thank you very much, Nadine. And as usual, before I go into some information, I would just like to give some stats regarding our operations thus far. Thus far, we have conducted 1,640 patrols, both foot and mobile, 147 vehicle checkpoints, 722 arrests. We have had 21 crimes committed during the period and 17 arrests. 26 persons were informed that they will be summoned for varying offenses regarding the regulations for COVID-19, and we have stopped 9,079 vehicles. Based on our new regulations, number 39 of 2020, Emergency Powers COVID-19, number 14, I'd just like to say that I would have explained what a public place is. Now we are seeing a number of persons who are willing to comply with the wearing of masks, and there are some persons who are still not doing so. However, based on my observation right here in Nevis, based on what I've seen so far, I've seen the majority of the persons are making that effort to wear the mask and wear the mask properly. However, we know that under the section regarding the mask, there are persons who are exempted from wearing the mask, and we want you persons not to go and make excuses for you not to wear the mask. Look at the intention behind the wearing of the mask, that is to prevent the spread of COVID-19. Yes, there are many persons who might be saying, okay, St. Kitts and Nevis, we don't have any local spread. But we have had incidents that can indicate it is likely that someone could have been present in the Federation and been among people wearing. I'm looking at persons who came into the country illegally and would have mingled with some persons. However, the test came back and the results are history. Also, I'd like to indicate to persons that, yes, there's a lot of restrictions have been removed. However, when it comes to persons going into the beaches, we're realizing that there are not much persons who are paying special attention to the regulations. So, once again, let me read. Public beaches. Persons may visit a public beach, A, for the purposes of swimming or exercises. B, where no more than 8 members of the immediate family should be in close proximity to each other. That number was smaller, now it's increased to 8. So, we're expanding accordingly. C, where there shall be no picnics. I shall repeat, there shall be no picnics, beach parties, or other gatherings. And D, where all persons shall adhere to social distancing and physical distancing protocols pursuant to Regulation 7. I've seen where a number of business establishments are making that effort to ensure that they are adhering to. What is the enforcement aspect? I go to some establishment, they say, no mask, no entry. But when you enter, I wonder if it's a different place I'm in. I'm saying to you, you are in violation of the regulation. I'm encouraging you at this time. Come on board. Ensure that persons who enter comply. If they fail to comply, you have the authority to send them out or call in the authorities to deal with those persons. Also, passenger buses, ferries. Yes, some of you are complying, some are not. I'll deal specifically with the bus drivers. I've seen where I'm at a remote, not a standstill position, and a bus pass, and a bus driver, the driver, no mask on. And as the vehicle passes, you see a window, a few persons inside there without masks. Drivers, I'm saying to you, you're violating the regulations. You need to comply. My officers, based on the instructions I got from the commissioner and what I give to the juniors, I am not going to be lenient on you. So I hope that my juniors will be the same. We need you to comply. You are providing a public service, and you must make every effort to comply with the regulations given you. And finally, I'm still hearing where some persons are attempting to visit our quarantine sites. Let me read Regulation 14. Restriction on visitation. No person shall visit or be permitted to visit A, any place of quarantine or isolation. B, any patient in a hospital or residential care establishment or facility, including an elderly nursing home. No police on site supposed to tell anybody, come and bring something for somebody there. If I know that, that officer will be disciplined. I'm saying to you, my junior ranks, do not let people encourage you to breach these regulations. You're there to enforce it. And that we will do. I understand some of you have your relatives there. Some of them might be out of the Federation for some time. But remember, it is better to be safe than sorry, you know the old saying? So let us go through the process of the 14 days, and when the results come back, yes, they're free to go because they are safe to come and mingle with you. As opposed to, later you find that one of them is positive. You might be older, you might have underlying health issues, and then you might be on your way to death. I'm saying to you, please do not go and visit the quarantine site. We are saying to you that once you adhere to the regulations, we will not have issues. We will not have issues wherein we have seen around the world, we have many deaths. We have seen many people have suffered because of COVID once they would have recovered and tell the tale. Finally, I take this opportunity to thank God for his continued mercies and blessings on the Federation, wherein we have seen no deaths from persons who would have come down with COVID. They have total recovery. Also, all the essential staff, police, defense force, doctors, nurses, disaster, media who help us to bring the information to you. We're saying thank to you. And also all those persons who continue to comply and support the police and the medical staff. Those persons who are continuing to not comply, we are saying to you, assist us in making our country safer do enjoy the rest of the evening. Thank you.
Thank you, Superintendent David. Always a delight. I'd now like to welcome Dr. Duana Pemberton, who is a general practitioner at the Alexandria Hospital A&E Department. Welcome, Dr. Pemberton.
In terms of seeking care at the Alexandria Hospital, in preparation for reopening of the St. Kitts Nevis borders in October 2020, the general public is asked to take note of the following measures that will be implemented at the Alexandria Hospital. These measures are as follows. The Accident and Emergency Department is open 24 hours a day with access to providers ranging from emergency medical technicians, nurses, diagnostic radiographers, general medical doctors. The Accident and Emergency Department deals with genuine life-threatening emergencies, including loss of consciousness, acute confused state, prolonged seizures, chest pain, difficulty breathing, severe bleeding that is not stopping, severe allergic reaction or anaphylactic shock, severe burns or scalds, stroke, major trauma. The emergency department also deals with urgent conditions that are not life-threatening, including sprains and strains, suspected broken limbs, minor head injuries, wounds that are deep or wide requiring sutures, severe bites and stings, minor burns and scars, feverish illnesses of patients under 2 years of age, skin infections and rashes of patients under 2 years of age, eye issues, abdominal pain, and vomiting and diarrhea. Non-urgent conditions can be seen at your doctor's office or nearest community health center, including scratches and bruises, contraception, follow-up for chronic medical conditions, prescription refills, minor bites and stings, minor skin infection and rashes, or minor allergic reactions. There is a doctor present at each of the community health centers on a set day each week. On Monday mornings, a doctor will be present at the Butler's Health Center. On Tuesday afternoons, there will be a doctor present at the Brown Hill Health Center. On Wednesday mornings, there will be a doctor present at the Gingerland and Cotton Ground Health Center. On Thursday mornings, there will be a doctor present at the Charlestown Health Center. And on Friday mornings, there will be a doctor present at the Combermere Health Center. Registration at the Alexandria Hospital. All persons seeking care will be asked to sign in and write the time of their arrival at the front desk. A registration form will be provided, which must be completed in block letters. If this form has been completed in full before, your name, date of birth, and address will be required so that the previous record can be retrieved. Once registration is complete, you will be required to wait until they are called for your initial assessment or triage. If you arrive via ambulance entrance, a registration form will be provided. If you are unable to complete the form because of your medical condition, this form can be completed by your relative or accompanying persons to the best of their abilities while they sign you up at the front desk in the waiting room. Relatives and accompanying persons will be asked to wait in the waiting room while you are being treated unless directed otherwise by healthcare staff. All patients seeking care will undergo triage to determine the level of urgency with which they should be seen. In the absence of a life-threatening or serious condition, triage will determine when you will be seen. Triage ensures that persons with the most serious conditions are seen first. Please note that if your case is not an emergency, you may be asked to see your physician or nearest community health center. This will reduce waiting times for yourself and others seeking care. Persons with minor issues can be expected to wait up to 4 hours if they insist on seeking care for minor issues in the emergency room. Depending on your condition, you may have tests or treatment ordered, and in more serious cases, you may have to be admitted to the hospital. All services have a fee attached. You can inquire about fees at the front desk and set up a payment plan if needs be. At this time, all persons seeking care will be asked to wear a mask, keep a distance of 6 feet from others, and practice hand hygiene. I will now repeat it in Spanish for our Spanish-speaking community. En preparación de la abertura de las fronteras de San Kitts y Nevis en octubre 2020, se le pide a la población que tome en cuenta las medidas siguientes, los cuales que serán implementados en el hospital. Estas medidas son: el Departamento de Accidente y Emergencia está abierto 24 horas del día, con acceso a proveedores, incluyendo técnicos de emergencia, médicos, enfermeras, tecnólogos de radiología y médicos generales. El Departamento de Accidente y Emergencia se trata con emergencias potenciales mortales, incluyendo pérdida de conciencia, estado de confusión aguda, convulsiones prolongadas, dolor del pecho, dificultad para respirar, sangrado severo que no para, reacciones alérgicas graves, quemaduras o escalduras graves, ictus o trauma mayor. El Departamento de Accidentes en Emergencia también se trata de condiciones urgentes, los cuales que no son potencialmente mortales, incluyendo esguinces, sospecha de fractura de las extremidades, lesiones menor en la cabeza, heridas profundas que requieren suturas, mordeduras y picaduras severas, quemaduras o escaldaduras menores, enfermedad febril en los menores de 2 años, infección y erupción de la piel en los menores de 2 años, problema ocular, dolor abdominal y vómitos y diarrea. Condiciones no urgentes pueden ser tratados en la oficina de tu médico privado o en el policlínico más cerca de ti. Este se incluye rasgaños o mortadores, anticoncepción, seguimiento por condiciones crónicas, buscando recetas médicas, mordeduras y picaduras menores, infecciones y erupciones cutáneas menores, reacciones alérgicas menores. Un médico está presente en cada policlínico en días fijos de la semana. En Butlers, el lunes por la mañana. En Brown Hill, el martes por la tarde. En Gingerland y Cotton Ground, el miércoles por la mañana. En Charleston, el jueves por la mañana. En el Combermere, el viernes por la mañana. ¿Cómo funciona el Departamento de Accidente y Emergencia? El registro. Todas las pacientes solicitando cuidado tendrán que registrar y escribir la hora de su llegada con la empleada de recepción. Un formulario de registro será disponible, los cuales deben ser completados en bloqueo de letras mayúsculas. Si has hecho el registro antes, el nombre, fecha de nacimiento y dirección serán necesarias para que el formulario anterior pueda ser recuperado. Una vez que el formulario está completo, tendrás que esperar hasta que usted está llamado para la evaluación inicial. Si llegas por la ambulancia, un formulario de registro sería disponible. Si usted no es capaz de completar el formulario por tu condición, este puede ser completado por tu acompañante en su mejor capacidad, mientras te registra en la sala de espera con la empleada de recepción. Les pidamos a las familias y los acompañantes que se esperan fuera de la sala de espera mientras que el paciente recibe tratamiento, a menos que está dirigido por su personal de salud. Todos los pacientes solicitando cuidado serán evaluados para determinar el nivel de urgencia, por lo cual serán tratados. En la ausencia de una condición grave o potencialmente mortales, la evaluación determinará cuándo usted sería evaluado por el médico. La evaluación inicial asegurar que la persona con la condición más severa se trata primero. Las personas con problemas menores pueden esperar unos 4 horas si insisten en solicitando el cuidado para el problema menor. Dependiendo de tu condición, se puede tener pruebas diagnósticas o tratamientos indicados. También, dependiendo de tu condición, se puede ingresar al hospital. Todos los servicios tienen precio. Usted puede preguntar de los precios a la empleada de recepción y prepara un plan de pago. En estos tiempos, todos solicitando cuidado tendrán que llevar una máscara, mantener una distancia de 6 pies y practicar higiene de las manos. Thank you.
Thank you, Dr. Pemberton. That's quite a mouthful in both English and Spanish, and I hope the information is well received. I'd now like to welcome Nurse Chandrika Prasad Wallace, who is the Assistant Nurse Manager at the A&E Department and also Assistant in IPC, which is Infection Prevention and Control.
Good evening. COVID-19 guidelines while seeking care or visiting the Alexandra Hospital. If you are seeking care for respiratory illness, do not come directly to the emergency room if you are experiencing flu-like symptoms, fever, cough, or think you may have been exposed to COVID-19. Call ahead, and the number is 665-5473. I repeat, the number is 665-5473. Information will be taken from you and direction will be given on how to seek care and COVID-19 testing if necessary. Please follow these directions carefully to avoid yourself or others from being exposed to COVID-19 while seeking care. Visiting hours. All persons with cough and fever are kindly asked to refrain from visiting. No persons under the age of 12 are allowed to visit. Visiting hours for adult ward are adjusted to 4:30 p.m. to 6 p.m. Visitors outside these hours will be considered on an individual basis. Visiting will be restricted to accommodate immediate family and primary caregivers only. One visitor will be allowed per patient at a time and for a period of no longer than 15 minutes. Regarding the pediatric ward, visiting hours remain open. However, only mothers who are exclusively breastfeeding will be allowed to overnight. Visiting will be restricted to accommodate only parents or legal guardian. If you plan to visit the hospital, you are asked to call ahead, and the numbers are 469-5473, 5474, or 5475. When you arrive, you'll be screened and logged in. Required information such as sign-in time, name, address, phone number, name of the person you are visiting, and which ward you will be visiting will be logged in. All visitors will be asked to sign out on leaving. You will be allowed to visit the person to whom you have signed in. All persons visiting or seeking care are asked to wear a face mask. Perform hand hygiene on entering and leaving the compound. No hugging or sitting on the patient's bed. For the Flamboyant Nursing Home, visiting hours are from 10 a.m. to 2 p.m. All visitors are asked to wear a medical surgical mask onto the compound. Fabric masks will not be allowed. Medical surgical masks are not provided by the institution. One visitor will be allowed per patient at a time and for a period of no longer than 15 minutes. Reminders will be provided at the gate. These measures are for the safety and well-being of all. We appreciate your understanding and cooperation. Thank you.
Thank you so much, Nurse Prasad Wallace. Now I'd like to welcome Ms. Daniela Claxton, Principal Education Officer in the Department of Education, to provide us with some updates.
Good evening. Today, September 7th, 2020, marked the first day of the physical classes for our students here on Nevis. We applaud the hard work of all stakeholders in making this possible. Please note that we anticipate that there may be some challenges as we attempt to implement the protocols. We know that there have been some hiccups today, and we are asking our parents and the general public to be patient as we intend to use this week to observe the protocols in progress and to adjust accordingly. Thank you for your patience thus far. We took the decision to have a phased reopening of schools. Early childhood centers, students who are 4 years old, commenced today. Students who are 3 years old will commence on the 14th September 2020. At the Cicely Brown Integrated School, all students commenced school today. At the Joycelyn Library Primary School, Monday 7th September and Tuesday 8th September, we will have the kindergarten to grade 2 students. Wednesday 9th September, we will have grades 3 and 4, and on Thursday 10th September, grades 5 and 6 will join the other students. All students will be in school commencing that day. At the Ivor Walters Primary School on Monday 7th September, we have kindergarten, grade 3 and grade 6. On Tuesday 8th September, we have grades 1 and 4, and on Wednesday 9th September, grades 2 and 5. All students will be in school at this point. At the St. James Primary School, on Monday 7th September and Tuesday 8th September, we have grades kindergarten to 3, and on Wednesday 9th September, we have the other students joining them, for all grades will be in school commencing on that day. At the VOJN Primary School, kindergarten commenced classes today. On Tuesday 8th September, grades 1 and 3 will join, and on Wednesday 9th September, grades 4 to 6 will join their other colleagues. At the Charlestown Primary School, today Monday 7th September and tomorrow Tuesday 8th September, grades kindergarten to 2 will have their classes. On Wednesday 9th September and Thursday 10th September, grades 3 and 5 will commence. And on Friday 10th September, grades 4 and 6 will commence classes. All students will be in school on that day. At the St. Thomas's Primary School, Monday 7th September, grades kindergarten to 2, and Tuesday 8th September, grades 3 and 5, and on Wednesday 9th September, grades 4 and 6. All students will be in school at that time. At the Elizabeth Pemberton Primary School, Monday 7th September and Tuesday 8th September, kindergarten to grade 2. Wednesday 9th September 2020, grades 3 to 6. All students will be in school. At the Gingerland Secondary School on Monday 7th September, we had Form 1 students attending school for the purpose of orientation, as they missed their orientation last term. They will commence their shift system on Wednesday, 9th September 2020, when all students are expected to start classes, and Forms 1, 2, Learning Support, and Form 5 will have classes from 8 a.m. to 11:45 a.m., and then Forms 3, to 5, learning support will have classes from 12:45 to 4 p.m. Please note that learning support and Form 5 will be in school all day at the Gingerland Secondary School. At the Charlestown Secondary School, Form 1 had their orientation at 8:30 on Monday, 7th September 2020, and Form 5 at 1 p.m. Tuesday, 8th September, Forms 2 and 3 at 8:30 a.m. and Form 4 at 1 p.m. And commencing Wednesday, 9th September, Charlestown Secondary School goes into their full-time shift system. From 8 a.m. to 11:45 a.m., we'll have Forms 1 to 3, as well as learning support. And from 12:45 p.m. to 4:25 p.m., Forms 4 to 5 and learning support will remain. Sixth formers will start school. Form 6A will start school on Thursday, 10th September, and Form 6B will have the orientation exercise, and that will be announced shortly. The classes at the sixth form will be blended, with the larger classes being completely online. For the first 2 weeks of school, the focus will be on protocols, teaching the students the various protocols and practicing such protocols. We will also be focused on diagnostic testing, as we want to ensure that we are up to date and up to speed with where the students are, and to capture any learning recovery that needs to be done. So please note, parents, as we try to manage expectations, we're not looking for tons of notes in notebooks. We're trying to ensure that we understand where the students are so that we can serve them better. In relation to the school buses, we are going to close officially the bus registration process on September 14th, 2020. We have received many applications, and we want to thank parents for being very responsive. And as we continue to partner with you, for any parents who did not register for the school buses, we are encouraging you to collect a form at the Department of Education or either of the public secondary schools, the Charlestown Secondary School or the Gingerland Secondary School. We have hired bus attendants to work along with the bus drivers, and they commenced their duties today. We had an initial training on a Friday evening, and we will continue the training during their off time during this week. Their duties include welcoming students, temperature checks, sanitization, seating the students, maintaining order, cleaning buses between trips. We are also pleased to announce that we were able to have a soft opening of Site 2 of the Charlestown Preschool today, Monday, 7th September 2020. The initial location of the Charlestown Preschool was not able to accommodate the number of students who were enrolled in light of the protocols and the current situation with the COVID-19 pandemic. The new site is located at Farms Estate, and we have students there. The 4-year-olds are there, and they have started their interactions. And so we want to thank the parents for their understanding, for their patience. Some of the parents who are enrolled in Site 1, the 4-year-olds, we transitioned them to Site 2 to ensure that we were able to uphold the high-scope curriculum. We also hired additional cleaners to ensure that we have thorough cleaning of all schools. Parents, guardians, the community, please remember to make an appointment or call ahead prior to visiting the schools, as you can no longer visit without doing so. Commendations to the team at the Ministry and Department of Education, principals and school leaders, teachers, support staff, parents, and the children for your continued support and partnership as we embark on this new leg of our journey. Thank you.
Thank you, Ms. Claxton, for your updates. And now I'd like to take this opportunity to open up for questions from our media persons, if they have any at this point.
Monique, Washington, think it's observe paper. My first question is to Dr. Judy Nisbet. Flu season is fast approaching, as well as plans to reopen the borders. how will persons be able to tell the difference between the COVID-19 symptoms and the flu? And will catching the flu become an additional expense as persons might be asked to get tested for COVID-19?
Thank you, Monique, for your question. I understand your question, that persons may be having the flu and we may have cases of COVID-19 at the same time. It might be difficult in some cases to tell the difference, and that is true. And that's the reality. Okay, it's a upper respiratory. Both of them are upper respiratory tract infections. It all depends on what the symptoms are. So, if the symptoms are really severe, and we can make the differentiation, for example, a severe case of COVID-19, and we can make that differentiation, and then we can test the person for that. But however, in most cases, I am sure we will do testing for both to differentiate, and that's the only way we'll be able to differentiate between the influenza and COVID-19. It might be a little more expensive, but you can't really put a price on health. So we will just have to do that. Test for both influenza and COVID-19 to ensure that we know what we are working with. Thank you.
Thank you, Dr. Nisbet.
Morning, Washington. Think it's paper. My second question relates to temperature checks for children that will be going on the bus. Now, the children that will be going to school in the afternoon, so the afternoon shift, some of them walk to a specific location to catch the bus. Now, 12 o'clock in the afternoon or 11 o'clock in the morning, that's when the sun is the hottest in the day, and the child is walking in the sun. When the child goes on the school bus, their temperature, I would assume, would be off. How will a situation like this be dealt with? Will the child be asked to leave the school bus? Will they be asked to rest for a while before their temperature is checked? How will a situation like this be dealt with?
Thank you so much for that question, Ms. Washington. We took some time out and processed all of the applications for the use of the school buses. And one of the things that happened was that our staff at the department called each parent individually. We explained the procedure and protocols and expectations. We also asked parents to ensure that their children got to the bus stops early, so that in the event that they had to walk from especially a relatively long distance, that they would be able to cool down prior to coming. The fact is that we cannot wait an extra 10, 15, 20, 30 minutes at a stop or at each stop for the students. And so we also explained that if their temperature is elevated, we would have to contact the parent and continue the journey without them. So the parents understand that, and we will keep having those means of communication and spreading that information to the parents. And following the September 14th deadline, we will also have a follow-up meeting with parents to get their input. It's a collaborative effort, it's a consultative effort, and we don't have every answer for every question, but we really are trying to include as many voices as possible. Thank you for that.
Thank you, Ms. Claxton. Shamika Budgeon, Von Radio. We have received word from CMO Laws that the second batch of the Ross University students recently arrived in the Federation and is currently in quarantine. When will we see the return of the MUA students here on Nevis? I think I'll direct that question to Dr. Judy Nisbet.
Thank you, Shamika. We await word from the Medical University of the Americas concerning the return of their students. We are uncertain right now when they'll return, but we are prepared to work along with the university to repatriate their students and to bring in the new students also. So once we get word of that, we would be able to facilitate. Thank you.
Thank you, Dr. Nisbet. Shamika Budgeon, Von Radio. What advice would you give for churches who are interested in hosting open-air services? Do you think that it would be plausible at this time? Superintendent David.
Thank you very much for that question. There is no restriction on, say, churches to have their function. However, due to the fact that we are currently under the state of emergency with COVID-19, we still have social distancing and physical distancing, wearing a face mask. So once they can provide all of that to make sure that it is a safe environment, there'll be no issue in terms of a church to carrying out its functions to ensure that it's doing its mission. So that's what I will say where that is concerned. So if the pastors or elders, they have more concern, they can contact me, they can contact the task force here on Nevis, and we'll provide you with the necessary information. Or if they would like to get a copy of the current regulations so that they can read more for themselves, that's no problem. It can be emailed to them. Thank you very much.
Thank you, Superintendent David. Final question from Vaughan Radio. With just 24 days before the beginning of October, is there a date set for the reopening of our borders? Also, how does the task force plan on keeping all passengers in check? Will there be RT-PCR tests be given at the ports, or will persons arriving be quarantined for 14 days?
Thank you, Shamika, for that question. As far as I know, a date has not been set for the reopening of the borders in October, so I'm unsure of the actual date of reopening. Additionally, the protocols that would be enforced with the opening of the borders, those are now being drafted and not finalized. And as soon as they are finalized, in terms of whether or not we'll be testing at the border or whether or not persons will be going into quarantine for 14 days, that has not been finalized. And as soon as those are finalized, they will be made public. Thank you.
Thank you, Dr. Judy Nesbitt. That is the end of our question and answer from our media houses. So I just want to say thank you to all our presenters and thank you to our media houses. And please remember to continue to protect yourself. Keep practicing these measures, such as washing your hands with soap and water, cover your cough and sneeze. Avoid touching your eyes, nose, and mouth with unclean hands. Disinfect touch areas and surfaces often. Eat a balanced meal with fruits and vegetables. Practice physical distancing / social distancing. And use your face mask or face covering when in public. And stay home if you're sick. Our hotline numbers are still active, and we're here to answer questions related to COVID at 311 or 661-5051. And of course, I want to say thank you to the Nevis Disaster Management, Nevis Television, Caribbean Digital Display Limited, Cornerstone, staff at the Health Promotion Unit, and of course, task force members for making these briefings possible. I am Nadine Carty-Keynes, and thank you for joining us, and see you on Mondays at 8:30 p.m. for another edition of the Nevis COVID-19 EOC briefing here on Nevis Television. Thank you for viewing, and please do stay safe.